We are contracted through San Diego Behavioral Health Services to provide the mobile crisis response in San Diego County. We go out in teams of 3 to respond to people having mental health or substance use crisis in the community. Last year, California actually put out a mandate that every single county had to have their own non-law enforcement crisis intervention team. San Diego was just ahead of it a little bit. We are an alternative to law enforcement having to go out for mental health crises. We are filling a need. We're doing about 200 call responses a week and our team is made up of 3 individuals, a clinician, a case manager, and a peer support specialist. So someone who has their own lived experience. And I knew really early on that we were going to have to provide something to our staff to help ensure their safety. So when we first opened, I actually looked into a lot of different devices before I landed on PERSA. So we worked with you guys to set it up to where when someone presses the panic button on their device, it goes directly into our call center that I have dispatched manned 24/7. And it sends the GPS coordinates in a text message to all my supervisors and via email. It's been a game changer for my staff because they feel super confident going out on the call to know that if they had a situation where they couldn't pull their phone out and press 911, they can press the device and it'll get immediately to a supervisor and our whole team to know that they're in a crisis and they need help. We cover the entire county. So there are a lot of areas where our staff do not even have cell phone service. So it was really important to me that the PERSA device worked even in those areas where they don't have cell phone service. So we have tested them out in multiple locations where they don't have cell phone service, and it still sends us exact coordinates as to where they're at. Because we train our staff to only press it if you cannot get your phone to dial 911. For the staff, it's a requirement. They have to show up for their shift. It's a part of their uniform. We've got 130 employees. The way that I've decided to do it for my program is we buy it for every staff member. So I wanted to limit the amount of barriers we had to crawl through to call 911 and get help out to them. The job is inherently dangerous, and so that's why it was super important to me to put as many levels of safety that we could to make the work as safe as possible to do it.